Blood pressure refers to the force with which blood pushes against the walls of arteries as it is pumped through the circulatory system. It is typically measured in millimeters of mercury, mmHg, and consists of two numbers, the systolic pressure and the diastolic pressure. The systolic pressure measures the force when the heart contracts and pushes blood out into the arteries, while the diastolic pressure measures the force when the heart relaxes between beats. There are two main types of blood pressure: high blood pressure, hypertension. This is when the pressure in the arteries is consistently too high. It is usually defined as a systolic pressure of 130 mm of mercury or higher, or a diastolic pressure of 80 mm of mercury or higher. High blood pressure can increase the risk of heart disease, stroke, and other health problems. Low blood pressure, hypotension. This is when the pressure in the arteries is consistently too low. It is usually defined as a systolic pressure of 90 mm of mercury or lower, or a diastolic pressure of 60 mm of mercury or lower. Low blood pressure can cause high blood pressure, also known as hypertension, is a condition in which the force of blood against the walls of arteries is consistently too high. This can cause damage to the arteries, leading to a range of health problems. The effects of high blood pressure on human life can be significant and include increased risk of heart disease. High blood pressure can damage the walls of the arteries, leading to the buildup of plaque and an increased risk of heart disease, heart attack, and stroke. Kidney damage. The kidneys rely on a healthy blood flow to function properly. High blood pressure can damage the blood vessels in the kidneys, leading to kidney damage or even kidney failure. Eye damage. High blood pressure can damage the blood vessels in the eyes, leading to vision problems or even blindness. Cognitive impairment. High blood pressure can increase the risk of cognitive decline and dementia in later life. Sexual dysfunction. High blood pressure can contribute to sexual dysfunction in both men and women. Poor quality of life. High blood pressure can cause fatigue, difficulty sleeping, and other symptoms that can affect. Low blood pressure, also known as hypotension, is a condition in which the force of blood against the walls of arteries is consistently too low. While low blood pressure is generally considered to be a good thing, as it can reduce the risk of heart disease and stroke, very low blood pressure can cause a range of health problems. The effects of low blood pressure on human life can include dizziness and fainting. Low blood pressure can cause a lack of blood flow to the brain, leading to dizziness, lightheadedness, and even fainting. Weakness and fatigue. Low blood pressure can cause a lack of blood flow to the muscles, leading to weakness and fatigue. Rapid or shallow breathing. Low blood pressure can cause a lack of oxygen to the lungs, leading to rapid or shallow breathing. Cold, clammy skin. Low blood pressure can cause a lack of blood flow to the skin, leading to cold, clammy skin. Poor concentration and confusion. Low blood pressure can cause a lack of blood flow to the brain, leading to poor concentration and confusion. Shock. Very low blood pressure can cause shock, which is a life-threatening. High blood pressure, or hypertension, often does not have any noticeable symptoms. For this reason, it is often referred to as the silent killer because it can cause damage to the body without a person realizing it. However, some people with high blood pressure may experience symptoms such as headaches, dizziness or lightheadedness, blurred vision, shortness of breath, chest pain, irregular heartbeat, fatigue, blood in the urine, nosebleeds. The symptoms of low blood pressure, or hypotension, can vary depending on the severity of the condition and the underlying cause. In some cases, low blood pressure may not cause any noticeable symptoms. However, some common symptoms of hypotension can include dizziness or lightheadedness, especially when standing up from a seated or lying position, fainting or nearly fainting, blurred vision, nausea, fatigue, cold, clammy skin, rapid, shallow breathing, confusion or difficulty concentrating, pale skin, depression or anxiety.